Chance to head over to Chattanooga Non-Surgical Orthopedics and pay a visit with Dr. Jeff Hall. Well, we are back in his office today. Last week we talked about low back pain. Today we're talking shoulder injuries, and that's a whole entity unto itself. So thanks for letting us come back.
You're welcome. Thanks for being here.
So, I guess it's kind of fitting that if this is your line of work, you would have a story to kind of accompany all the different ways that you can help people. So last time we heard about your back injury that you had. This time we're going to hear about your wife's shoulder injury because y'all are avid downhill skiers.
Yes. So I've had multiple shoulder injuries myself from mountain biking, but nothing like what she experienced. In January 2018, we were skiing at Snowshoe in West Virginia, and she fell in the lift line and shattered her shoulder to the point where she couldn't move her arm. She had to get ambulanced off the mountain.
Oh my word. Taken
to the ER, and they were showing me the x-ray, and it was just salt and pepper. The shoulder was completely disintegrated.
So in times like that, there you are, in this case, the spouse. Your emotions are running high. Did you kind of know right away what you were going to want to do to intervene?
Well, she's fell before. Typically, I'll just adjust it, but this one was beyond that. So that's why, medical care is needed in certain times. But what you do after you get the patient stabilized is a lot of people are told they need shoulder replacements or shoulder surgeries, and she was told that, but we didn't want to go down that route. So we did the 5 steps on her shoulder, and voila, she got 100% range of motion and strength back, 0 surgeries. It's unheard of. To the fact I was even on a lift a year later and ran into the ER doc, and he had recognized me. He was the guy that worked on her shoulder at the ER, and he was asking how her surgery went, and I was like, she didn't have to have it. And he was just bewildered.
He couldn't believe it.
He couldn't believe it because the x-ray it completely just exploded.
So I know we want to get into these 5 steps a little bit, because if you saw last week, he created the steps because of your own experience, both as a person and as a practitioner.
Yes.
To see what works. But when this happened to Stephanie in the ER, what did they do? Just stabilize it?
Yeah, just put her in a sling and give her a bunch of pain meds.
Okay.
And then told her to see an orthopedic surgeon to. And I was even thinking when it happens, like, oh, this may be out of non-surgical scope.
Okay.
Like, I truly was thinking she was going to need a shoulder surgery because it was so bad. It was such an aggressive injury. But it just shows the power that made the body heals the body when you do the right things to it, how the body can heal.
So, and which is your belief too, that that's what it's intended to do. So you have multiple things that you use here in the office. We won't make you give away all of the trade secrets. Years ago, you were on the show with me, and not knowing I had an issue, you began to do something on my shoulder.
Yes.
With the cold laser, right?
Yes.
And my shoulder would pop. And before you knew it, when Jeff would have me raise my arm, it hurt and I couldn't do it. I didn't know, but that was the case. And 3 moves up in less than 30 seconds, and I was perfectly fine.
Yes.
Are you still using that cold laser?
We are, and that's the first step, is you have to, remove the injury. So you use the cold laser to remove the injury, to reset the nervous system.
Okay, but now you use something else that you call...
Well, we've always used percussion.
Okay.
So, that was step 2 is, okay, we've reset the injury. Now we got to restore motion into the shoulder, because she had so many fascial adhesions where the arm, couldn't be moved for 3 weeks because, it's shattered.
Right.
And so what percussion does is it breaks up all that scar tissue in the shoulder, so you start getting range of motion back.
Okay.
And then we went into regenerative medicine, which helps regenerate the cartilage in the shoulder, helped regenerate the torn ligaments and tendons. And then we went into retrain, which is re-strengthening the shoulder.
So in my case, because you did the percussion on me, I have not shattered my shoulder.
Yeah, yours was easy.
But I still have this little bit of a pop. It's been years since you did that cold laser for me, and I was great. But it's kind of come back a little bit. So this can be beneficial for anybody, whether it's a minor issue or a major one.
Yes, a minor shoulder injury just playing baseball to major injury where someone has truly done damage to their shoulder. That it's so broad, anywhere from a tweak to destruction.
Do you see teenagers here, right?
Yes.
So do you ever have high school athletes who come to you and they've had an injury and they can get work with you to then help them further their game?
Yes, and I won't mention names, but we had a kid that played at a local high school, and he was a starting quarterback, and he was really struggling, like wasn't even getting recruited. And you know, we did our 5 steps on his shoulder, and within 2 weeks he was throwing again effectively, and ultimately got recruited to a team that won the national championship on the Division I level in football. So
we've kind of had a bit of a reunion, because Jeff used to come on the show a pretty good bit back in the day, and it was kind of COVID, I guess, changed things a little bit. But I know the first time I ever heard about you was through a coworker who, I won't go into names there either, one who had come to you for a knee problem,
yes,
and saved a knee surgery,
I remember him.
And the other one was a back issue. You remember?
Mm-hmm.
So the fact that you can help people with a myriad of problems, you kind of probably know the minute somebody comes in the door, don't you, how you're going to be able to help them?
Well, as soon as I sit down and talk with them, yes, because like I said, the age range is so broad here that we get anywhere from a teenager that, you know, sprained their ankle over the weekend playing soccer,
Mm-hmm.
to, you know, someone in their 60s, 70s that's had chronic low back pain and just wants some relief.
So now that Stephanie can raise her arm with no problem, she has to be the one to put up the dishes at the house?
She was doing that even when her shoulder was injured.
So if you are hurting a little bit, or if you have had an injury, even if that injury is old, you can still help, right?
Yes.
Give them a call. It's Chattanooga Non-Surgical Orthopedics. He is a laid-back approach, but very much knows what he's doing. You're a great listener, but you're the man in charge once they're in that office, because you know what you're doing.
Yes.
Good to see you.
Good to see you.